Good afternoon, and let us begin with the topic suicide and para-suicidal behavior. So we'll be covering it under the following headings. So suicide is derived from the term, a Latin term, which can be divided into su and cedium. Su means oneself and cedium means killing. So it is an act of deliberately ending one's life. It is a major public health issue and a very emergency issue for mental health professionals. A suicide attempt is when people harm themselves with the goal of ending their life, but they do not die. Suicide pact is an agreement between two or more individuals to die by suicide together, usually the same method and at the same time. Example, a couple may decide to end their life together by overdosing on any sleeping pill. Copycat suicide, an individual attempts or completes suicide after being influenced by another person's suicide, particularly someone they admire or identify with. A suicide survivor is someone, a family member or a friend of someone who has died by suicide. This is a term which we use for suicide. Para-suicidal behavior, any non-fatal, serious, deliberate self-harm with or without intent of suicide. So here the intent part is important in para-suicidal behavior. The intent is not clear. Like in suicide, it is clear we have to harm ourselves. In para-suicidal behavior, it is not that clear. Parasuicidal behavior is often used as a coping mechanism or cry for help in the face of overwhelming emotional pain or distress. Another term is suicidal ideation. These are the thoughts, ideas, or plans about ending one's life. It can be active or passive. Active people might plan properly, but there is no action taken. And in passive suicidal ideation, patient might say, "Ki, I wish I do not have to wake up in the morning." These kind of sentences. So suicide is a leading cause of death worldwide among the age group of 15 to 29. WHO says that approximately 700,000 people die by suicide each year, and for every suicide, there are many more attempts. In India as well, NCRB data of 2021 says that approximately 164,000 recorded suicide were there. Recorded suicide, there are several which would have not been even recorded. 12 per 100,000 in India, the data stands. Highest rate is among 18 to 45 age group with notable gender difference. So the committed suicide are more high in male, whereas the attempted might be more higher in female, but the rising tendency towards female suicide is also being seen. In states like Maharashtra, Tamil Nadu, West Bengal and Karnataka, higher rates are there. Agrarian or a farmer suicide and students are at higher risk of committing suicide. So certain theories of suicides are there, which is again biological, psychological and social. Biological theories are like neurotransmitter theory, like particularly serotonin and its metabolite 5-HIAA have found to be comparatively low level in a patient who commits suicide. Again, genetic predisposition in family and twin studies indicates that genetic factors may contribute to suicide risk. Individuals with a family history of suicide or mood disorders are at higher risk of suicidal behavior. Then psychological theory, Sigmund Freud have given internalized aggression the term. He says that there are several conflicts which are there, actually like guilt or some loss which may manifest as suicidal thoughts. Aaron T. Beck, as we all know, gave the 3 hopelessness, helplessness and worthlessness criteria of suicide. Escape theory is something which says that patient, in order to escape the intolerable psychological pain, failure or self-perceived inadequacy, commit suicide. Again, Thomas Joyner gave 2 key psychological states. एक तो word term है perceived burdensomeness. The patient believes that that I am a burden over other and death is the ultimate solution which would be beneficial for my loved one if I passed away. Thwarted belongingness, the feeling of isolation and lack of meaningful connection with others. Very important is this social theory. Durkheim's theories have divided suicide into 4 types: egoistical, altruistical, fatalistic, and one more is there. Egoistical theory says that individuals feel disconnected from society or lack of support. People may feel alienated or isolation and may contribute to a sense of meaninglessness. Altruistic is something where people are very much involved in the society and social group. They may sacrifice their life for perceived good of the people. For example, war. Anomic suicide is where societal instability or normlessness, like someone has lost a job, sudden economic collapse is there, So patient commits suicide. Fatalistic society result from excessive social regulation and control. People may feel oppressed or rigid by rigid societal structure or life circumstances, like people in abusive relationship or prisoners. Social learning theory, patient Albert Bandura gave this theory. He said that it can be learned from observation and imitation, especially patients who have particularly within family, social group or media can influence. The term is called contagion or Werther effect. Etiological and risk factor, again biological factor, again we have discussed already. Genetic predisposition, neurotransmitter dysregulation, brain abnormality. Psychological, cognitive distortion, personality disorder, mental health disorder, substance abuse, social environment, employment, poverty, social stigma, social attitudes towards honor, shame, and easy access to the things which can lead to cause suicide. In psychopathological, personality disorders are very much associated with parasuicidal behavior. This is biopsychosocial model of suicide. Are there any warning signs of suicide which say कि patient बात नहीं करता, ऐसा कुछ नहीं है. There are certain things which you should know. Patient talks about wanting to die. There is a feeling of guilt or shame, being a burden to other. He might feel hopeless, helpless. Behavioral changes. He might started acting very rash. He might involved in some sudden substance consumption. He may plan or research the way of dying. Withdrawing from friends, saying goodbye, giving away your possessed thing, making a documented will. These are something which should be taken into consideration. Suicide methods, hanging, drowning, poisoning, firearms, and overdose of medication. Whereas parasuicidal behavior like cutting self, hitting oneself, banging head, overdosing on non-lethal medications, and superficial burning. This is also NCRB data which shows that hanging is still the most common method of committing suicide. If the patient has attempted suicide, determine the method, timing, and circumstances of the attempt. Inquire about suicidal ideation, inquire about frequency, duration, and intensity of thoughts. Ask whether the patient has a plan, develop the plan, determine if the plan is specific, feasible, and time bound. Assess the patient's intent to act on these thoughts. Inquire about any previous suicide attempt or parasuicidal behavior, any psychiatric illness, rule out any drug or substance abuse, any chronic pain or illnesses there which can also lead to the suicidal or parasuicidal ideation. Find about any stressor, how is the support system or coping mechanism. In mental status examination, appearance and behavior of the patient, mood, how he is feeling, how do you see patient is appearing to you, whether in his thought content there are hopelessness, helplessness, or any active suicidal ideation or passive suicidal ideation present. How is his insight and judgment towards himself. There are certain scale, like for example, Columbia Suicide Severity Scale, sad person scale. This is the example of sad person scale. So how do you manage the person who is has attempted suicide or has made a parasuicidal attempt? First of all, if the individual has attempted suicide, immediate medical stabilization is the top priority. Monitor airway, breathing, and circulation. Initiate necessary steps such as gastric lavage or intravenous fluid depending upon the substance ingested if the poisoning patient is there. If there is any overdose, see for any antidotes are there. If at all activated charcoal for certain injections are required, if it is there. If there is any self injury, life-threatening injuries, deep cuts or self-inflicted would manage proper medical care. Even in parasuicidal behavior, which is not intended to cause death, the physical consequences should be treated immediately. Once the patient is medically stabilized, a comprehensive suicide risk assessment should be conducted. Remember three terms: intent, lethality, and method. The presence of ongoing suicidal ideation is there or not, these things should be kept in mind. In parasuicidal behavior, assess the frequency and motivation behind the harms. There might be certain emotional overwhelming, there might be certain attention seeking behavior or any triggers which can lead to parasuicidal behavior. Create safety plan with the patient like identifying triggers, coping strategies, removal of the mean, ensure that the lethal means firearm, medication, sharp objects are removed, consider hospitalization. Once hospitalized, why are you hospitalization? Why do you hospitalize the patient? If there are any active suicidal ideation with a clear plan or intent, if there is any severe psychiatric condition like psychosis or severe depression, past attempt of suicide is there. Once the patient is hospitalized, please monitor 24/7. Patient should be in a safe suicide-proof environment. Even in the ward, itself there should be no object including दुपट्टा दवाइयों का कुछ भी है वो नहीं होना चाहिए जिससे वो अपने आप को harm कर सके. He or she should be even assisted when he is going to the bathroom. Pharmacological management, antidepressant, antipsychotic, mood stabilizer, benzodiazepines. Brain stimulation, ECT is one of the most preferred and most utilized method. अगर patient में suicidal, active suicidal ideation है, ECT is very much preferred. RTMS is another one method. Pharmacotherapies में cognitive behavior therapy is most effective, wherein the cognitive distortion, which will focus on your negative thoughts with healthier and more realistic thoughts. Coping strategies and how to deal with stress will be taught. DBT is said to be more beneficial for personality disorder, wherein the parasuicidal behavior is being found. Mindfulness based therapy, wherein you will be taught how to acknowledge what you are feeling. Mental time बच्चों को पता ही नहीं होता when they are getting angry, when they are getting sad, to acknowledge that feeling. Why are these thoughts and emotions coming, and what are these thoughts and emotions? Involvement of the family is critical, and rehabilitation and aftercare so as to prevent the future attempts and for a beneficial afterlife of the patient. Public health initiatives to prevent suicide, like district mental health programs can be there, media campaigns can be there, school and college mental health initiatives are also taken into consideration. Farmer suicide prevention, government schemes such as loan waivers, agricultural counseling and farm support for financial stability. Reducing access to lethal means already discussed before. What are the challenges? Stigma and mental health is still there despite advancements. Stigma around mental health and suicide remains high, preventing many people to seek help. There are certain traditional beliefs, family honors, which play a crucial role in seeking help. Lack of resources, shortage of mental health professionals, and lack of awareness is one of the few challenges which we see. Legal issue Mental Health Care Act provides rights to individuals with mental health issues, including access to mental health service and privacy. Involuntary admission can be taken into consideration when person poses a threat to himself. And Section 309 IPC decriminalize जो कि suicide को criminalize act बोलता था, it has been decriminalized in 2017. These are certain helpline numbers, especially Kiran is a government initiative, government mental health helpline which works 24/7. There are Smartians in Mumbai, Astra, I don't know whether it's in Hyderabad, no, it's in Bangalore, I guess. Roshni and Snehi are another help group which can be consulted. So to conclude, these are preventable behavior which can be suicide and parasuicidal behavior, very much preventable public health issues and required urgent attention, awareness, early identification and intervention by healthcare profession. And it is again requires collaborative approach involving medical professionals, social work, community support and government. And we have to keep a point ki reduction of stigma and increased accessibility of mental health care should be there.